mask, and he came up with an idea that every ratio, as I mentioned, he made a mask with that. And he said, okay, so if we have so many golden ratios, and by using all these ratios, I have a mask, and if that be the mask, shall I put this mask on every face? And if it fits, then does it mean the person is beautiful? That was his study, and he found out that it was true. And he very clearly disagreed that beauty is in the eye of the beholder. Because beauty is a science. You can alter the dimensions, you can change, and you can get to beautiful people, this thing. So it's an art, it's a science in today's world of developed medicine. So that's something which I thought is a take-home message. So what he did was, he took this mask and tried to superimpose it on faces that have been mentioned as beautiful down the ages. This is Queen Nefertiti. And then you have, I think this is the Greek god Apollo. And then another painting. You see how the mask is fitting perfectly on all these faces. Now this is already 1505 AD, and that was 1300 BC. Now this is 70 years old. That's Marilyn Monroe. And then now you have Angelina Jolie. And they found out that if the mask fits correctly, that face could be called a beautiful face. So now, what is the idea? That means you have a range. So they classified faces into a beautiful face that fits perfectly, an attractive face that fits about 85-90%, then you have an average face that, roundabout fits, then you have an attractive face, and then you have a really unattractive face. And as you go down this, you see that the discrepancies and the difference in ratios are going on increasing. Now, if you have a patient who has a very unattractive face, I generally tell them, look, we can take you up the next ladder, but it's one rung at a time. So you just can't make them beautiful straight away. And there are certain limitations also in this, but generally you can, this concept also makes gives you a tool to explain to patients and make them understand as to what's happening. Okay, so, well, I just put this to show that none of these beauties are natural. All of them have had various tiny procedures in different parts of the face, nose, and everywhere else. Anyway, so I also wanted to touch upon this anti-face. So anti-face means your lower third of the face. This is your upper third, your middle third, and lower third. The lower third is from the end of the nose till the chin. This has to be strong, because in today's world, you like to have a strong personality, and that is indicative of that. And even though in the yesteryears this wasn't a very popular kind of face, anti-face is very popular today. And this is, I don't know how many of you know this actress from South India, from Bangalore, Shilpa Shetty first, and this was eventually how she's now. And so many people. Okay, I've put some more facial aesthetics. Okay, now this is a study which they found out that the divine proportion, which is equivalent to facial beauty, see that third point, is equivalent to T&J health. So, when you have things in the normal ratios, also indicates there's health. There's fertility. There's so many things that's happening. What I'm trying to say is, when you have a normal anatomy or a perfect ratio, then a lot of these things fall into place. Okay, now to the next part of the whole thing. Is golden ratio, or is the ratio only enough for beauty? No. For the face, we need symmetry. This was a picture I found in Malaysia on the rock. But this I just took to show that if one side of the face is not symmetric to the other, then no matter what proportions you have on the normal side, they don't look beautiful. Our eyes don't appreciate that. So you need to have facial symmetry. So we touched upon three things: golden proportions, ratio, symmetry. This is Ralph Waldo Emerson. And then the most important, I didn't mention so far, is function. So the teeth, chewing. That's the main reason we have teeth. Second main function of the teeth, to speak clearly. Otherwise the syllables don't come out very well. So I think function of the various aspects of the face, for example, the function of breathing, smelling, talking, seeing, all of these things, snoring, or higher than the ratio